I realized that there's this whole world behind disease, and that as doctors, our responsibility is to treat that as well as the disease. Working with patients in most need of care, the chronically ill, patients with HIV, tuberculosis, chronic diseases in general, just led me to understand that there is all these other components, their relationships to their families, their relationships to the community, and how patients can access treatment. Psychiatry presents that opportunity.
At Morningside and West, our psychiatry and subspecialty training programs have a long tradition of providing a supportive learning environment together with ample diverse clinical training and lots of opportunities. Our goal is to train the next generation of thought leaders in psychiatry who are competent and confident clinicians, educators, and specialists in their field.
As part of the Mount Sinai Health System, we are proud to help set the standards for psychiatric care and address the full range of biological, psychological, and social factors that impact our patients' health. We see the humanity in our patients from all walks of life and work to help them recover their hope and reach their goals.
I interviewed throughout New York, and so I had a chance to compare a lot of the different programs, and Mount Sinai Morningside West really stood out for me.
This program attracts residents who are compassionate as well as intellectually curious, and it's really a pleasure for me to see how residents bring their individual personalities, training, and interests into the practice of psychiatry.
In order for you to actually learn medicine and practice good medicine, you need to have a lot of experience. You need to be in touch with a lot of patients and different pathologies.
For Morningside and West, being on the west side of New York and some of the only hospitals on the west side of New York, we see an incredible diversity of cases. We have an opportunity to work with a really underprivileged, under-resourced population. We also see the opposite of that spectrum, really affluent patients. We see a real breadth of diversity in the cases themselves in terms of psychosis, bipolar, depression, anxiety.
In your first year, you're practicing hospital-based psychiatry or medicine. On the psychiatry side, you will be mainly in the inpatient unit as well as the psychiatry emergency room. And you'll be going to both sites, Mount Sinai Morningside and Mount Sinai West.
Our residents rotate through the Addiction Institute in their second year of training, and many choose it for elective time in their fourth year. We have a diverse patient population and state-of-the-art evidence-based treatment, and we emphasize a patient-centered harm reduction model.
Second year, you're going through hospital rotations again, but also intensive outpatient. And then your third year is your outpatient year. You're at the outpatient psychiatric center. You have your own patient caseload.
In fourth year, you will have the opportunity to be a senior in one of the units, either the outpatient or the inpatient, depending on what you want.
I think that one of the biggest things is really confidence. It's a really amazing thing to question yourself so much at the beginning. You're really wondering, how am I helping people? What am I doing for them?
I love my co-residents. I count them as some of my best friends. I'm so glad to have met all of them and been through this time together. I'm getting teary-eyed thinking about it.
We are around 45 residents. We all come from very diverse backgrounds from all over the world. We come to this city where we don't know a lot of people, so we have each other. And then we start learning from each other. You start seeing how the different approaches to mental health create this culturally informed way of treating patients.
I am really proud of what I've learned here. It is such a privilege to be invited into people's lives and for them to put some level of faith in you during their times of suffering. And that has been such a moving experience. It has absolutely changed me as a person, and I hope that I'll continue to carry that forth with me.